Zika is making headlines across the country as the CDC warns pregnant women to stay away from a Zika transmission area in Florida. And here in Utah, new information tonight on the mystery of how the Zika virus spread from a dying man to his son. News specialist Lat Egan's live in Salt Lake City with a case that continues to baffle health officials. Lat?
Yeah, Dave, and why this is so confusing to health officials is that mosquitoes, the most likely transmission source, don't look to be the culprit here. In order to rule mosquitoes out, health officials and mosquito abatement officials went into a neighborhood where this elderly man died, and they looked for mosquito eggs and also set traps for adult mosquitoes, which were then tested.
There isn't anything that would surprise me right now about Zika virus.
A lingering mystery about how the Zika virus behaves centers on a single Utah case.
Really highlights potential other modes of transmission that really beg the question, how is this virus being transmitted?
Other than sexual transmission, the tropical virus rarely spreads person to person, which is why the hunt is on for how the virus jumped from an elderly man to his caregiver's son.
We do know that Zika virus can be detected in high numbers in urine and saliva.
There were many people that that did volunteer and wanted to be tested.
Epidemiologist Dallin Peterson is the lead investigator on the case. In conjunction with the CDC, Utah health workers went door to door collecting nearly 100 blood samples. The testing is ongoing, but so far there are no positive cases.
We were trying to investigate what that relationship was, how that family contact that did not have foreign travel could have also tested positive for Zika virus.
So we know that the invasive mosquitoes are not present, and we know that local transmission of Zika virus is not occurring with our native mosquito populations.
While mosquito control officials are confident the Aedes aegypti mosquito isn't in Utah, they still want residents to be on the lookout for mosquitoes hanging around homes.
If you notice a small black and white mosquito, if you're being bit during the day versus the dawn and dusk periods, let us know.
Because of privacy concerns, the neighborhood in Salt Lake County is not being identified. But what we do know is that health officials established a perimeter around that home, a surveillance zone of about 3.5 football fields. There were about 285 homes inside that surveillance area. And what's interesting about this case, Dave, is that if this had happened elsewhere, they may not be forced to look for how the virus jumped from the father to the son. In other areas like Florida, where the Aedes aegypti mosquito is very prevalent, they would have just assumed that was the case. But here, they don't think it was the mosquito, so now they've got to look at what went on here. So it should be interesting to find out what exactly happened.
Quite the mystery. Lat Egan, live in Salt Lake City. Thank you.